let's talk about cognitive behavioral therapy.
Yes.
Grace, you wanted me to touch upon that. What is that?
So in cognitive behavioral therapy, what we're looking at, and I know we've heard this about therapy in general, or in life, it's if you think of something, then that immediately affects the way you feel about it, which then affects the way you behave. So some of the things that, as an example, if you think, I don't know, Amy, I'm losing it right now.
It's all right.
If if I think that I'm gonna do poorly on this exam,
Yes.
right? Then I'm already setting myself up. I have my anxiety, so now I'm going into the exam, and the behavior that ensues is follows up with that anxiety, and so then I end up doing poorly on it. So it becomes this cycle of how, just like Grace says, thoughts, feelings, and behaviors can interact, and actually vice versa. We put it out in that formula, but it can go backwards too, and that's where exercise, we call it behavioral activation, comes into play. Super important, because if I get myself moving, that can start ensuing with those positive thoughts.
I want to also touch on when you have somebody who gets diagnosed with something else, like a cancer or even diabetes. All of a sudden they're thinking, I'm sick, I don't feel good. And that then starts creating the thoughts. If I don't feel good, then maybe there's something wrong with me. Maybe I am sick. Maybe there's something worse. And then that then creates the cycle of then staying home or staying in bed and not wanting to get up because you already think there's something wrong. And so that's where having the cognitive behavioral therapy bring in the different tools, the thought stopping techniques, the way to help you change your thinking. We have a lot of automatic negative thoughts, and so part of the cognitive behavioral therapy is to help you stop that. Is how do you intercede into that?